So, Dr. Rita, thanks for joining us. Everybody, we're joined tonight by Dr. Rita Ellithorope, and she is a doctor. Are you a doctor of integrative medicine? One of the first questions we have is, what is integrated medicine, and how would that be different from a general practice physician? Or
I suppose there are many terms used to describe doctors who have an open mind to looking at natural solutions, and the natural solutions very often and preventative measures help to keep their patients healthy and not progress on to the need for pharmaceuticals. So if you say integrative medicine, one definition would be we would take the best of necessary allopathic standard pharmaceutical, surgical, radiological imaging testing, and we merge it with the natural preventative measures. So we would say we are a doctor who can do both things. So we're licensed to prescribe medicines like a standard licensed medical doctor.
And currently, you're working in an anti-aging facility right now. Is that correct? Or
I would say, yeah. I these are general terms.
Okay.
Anti-aging.
You teach anti-aging, yes.
Yeah, we teach preventative medicine, and that keeps you healthier, and that keeps you younger and more capable. So to that degree, I'm guilty as charged of anti-aging medicine. Yeah, I did the A4M board certification for this when it first started many years ago in the 1990s. My father was in food research. When I was a little girl in Chicago, Armour Food Research was a meat packing, Armour hot dogs. What kinds of kids eat Armour hot dogs? Mm-hmm. I'm that kid. Mm-hmm. But my dad learned right away in the 1950s when I was a little girl the corruption of the food system. So I have been born into this since I knew about trans fatty acids when I was 7 years old.
So you tried to prevent the illnesses as a doctor. Are you focusing more on preventative medicine than treatment? Is that pretty much where you're trying to focus your energies? So
yes. Absolutely. And for those who already have a disease, we have hope for recovery and to be able to heal and possibly reduce or eliminate their medications.
So one of the things our show has been very much focused on is the COVID-19 crisis that's been underway now for over 6 weeks, I suppose. It's since its first I think it's been about 6 weeks, if not really close to that time. And so we've been talking about that. We've been talking to different people, different doctors, different scientists, and people who have different fields that they're working. And so you're, as a doctor, are you seeing a lot of COVID-19 related treatments happening in your immediate practice? Are you dealing with any of that, or what's your direct experience currently with that?
I'm seeing, just as I saw last flu season, people coming in with a flu-like illnesses, all right? And under flu-like illnesses in the CDC, we're not required on outpatient to do nasal swabs or PCR testing to identify anything about them. They have what is considered a common non-serious flu. And that's what I'm seeing. All my patients that have come to see me have been so healthy that I have had no reason to send them for hospital management or to even do any testing to confirm whether or not they might have COVID-19. And then even the question about the testing, to confirm COVID-19 is something that's argued amongst scientists.
Right. So currently, the way it seems to be happening is if somebody was admitted to the hospital for any type of treatment, right? Maybe and I don't want to say any type, all sorts of types of treatment. and it could be they could have some sort of well, let's just say they have general treatment, right? They're in there for appendicitis, right? Let's just say, and they would test them for coronavirus, isn't that right? That they're testing people across the board to see if they've got coronavirus in a way that they wouldn't normally do for other conditions.
In general, they're doing a wide swath of testing for all patients that come into the hospital with any type of fever or upper respiratory illness. If there was someone who presented to the emergency room with a broken leg, I don't think they're going to do that. Mm-hmm. And they do have to handle those kind of acute care episodes. But those who get tested for COVID-19 are being tested with what we call reverse transcriptase polymerase chain reactions, RT-PCR, which is looking for, in DNA, the double strands are nucleotides in pairs. And they're saying that the COVID-19 virus is new. So apparently in the standard coronavirus, there's a section of it that appears to be new and has some features in articles that I'm reading that have a genetic sequence that are similar to this original SARS coronavirus in 2002. And some parts of the nucleotide sequencing may have even some HIV, because HIV is also a type of rotavirus, coronavirus. And so the testing then of coronavirus by looking at a SNP of just nucleotides based on a nasal swab and then put through an RT-PCR looks for that and amplifies it over and over to see the sequencing or a part thereof. And then we'll say, yes, we think this is the new SARS COVID-19 sequencing. But there's a postulate out there in medicine. We were taught the Koch's postulate. Koch's postulate was a famous doctor who got the Nobel Prize, I think, around 1895. And Koch was a German who said, if you want to diagnose or give something identification, you have to isolate the pathogen. And then you have to put that into another animal, and you have to see that animal manifest the exact same clinical features that drew you to test the first person. And then you have to take the pathogen out of that infected animal and introduce it to another and grow out this pathogen to see the actual item. So it's beyond a doubt that you have isolated the correct pathogen and you're calling it a true item. So Koch postulate has at least 4 elements. I'm not sure if I listed them all, but the idea being we are not following that program here. We are using PCR, and Mullis, who got the Nobel Prize for developing the polymerase chain reaction, he himself thought that this was really for diagnostic, not diagnosing a patient, but was a laboratory assay as the explosion of the Genome Project and studying genes and gene sequencing as opposed to ever being used for diagnosis. So I want to be clear, they are not viral culturing people out. There are tons of Petri plates out there with a patient's name on it, and they're culturing out a virus. This is not happening, to my understanding.
So they haven't. They're just finding certain markers that they could allude to being COVID-19, but they're not. They haven't isolated it as they should, using that postulate, Koch's postulate. So they're using another type of a broader type of diagnosis in this case, and it's not as certain. So that brings us to the question we have is, let me see how it's written here. How accurate do you think these numbers? So like it says here, to date, 56,000 people have died of coronavirus. I don't know if Paul wrote this. I don't know if that's worldwide. I'm not up to date on the numbers.
No, that's U.S.
That's okay. So how accurate? Because the United States actually, I think they've even said that they're more liberal in their diagnosis and labeling people having COVID-19. How accurate do you think this number is?
Well, let's put it this way. If you are worried about a serious, life-threatening beyond the regular seasonal flu, it would be better to be liberal in your inclusion and diagnosis rather than to miss people. For instance, when I went through my general surgery rotation, we were expected to have up to about 5% of all of our appendicitis cases to be healthy, normal appendixes removed. You understand what I'm saying? And if your rate of appendix removals doesn't include close to 5% healthy appendixes, then you're too critical in screening and leading to protecting people from their appendix rupturing, bursting, and killing them. Okay? So it isn't that I'm against PCR testing or the nasal swab. I'm just trying to be scientific and accurate about what our criteria are, okay? And our criteria are not based upon viral cultures, okay? You clear on that? So is the number 56,000 as I look at the Johns Hopkins map on my computer? Well, I would say there are 56,144 that they believe, the doctors believe, either met the clinical definition or had the nasal swab PCR test and or they had some other serological testing. So, yes, I would say that's true. Is that an overestimate? I would hope it would be an overestimate. To deal with a serious pandemic, you have to be more liberal to protect public health. But then the question you really should ask is, what is the doctor on the front line seeing? I'm one of the doctors who never closed. I've been here every day. I never missed a day of work, nor my other doctors here. And none of us in our general practice, and we see from children to the elderly to the very sick to the athlete, I would say close to 40% of my patients are Medicare, which would be in the higher risk. And I have had none of them, even those that have cancer, who have had any significant flu-like illness. And so I haven't tested anybody.
Okay, so what would be your procedure if you did? If somebody presented those types of symptoms, what would you do to check to see? Just if somebody was curious to know how you would handle that.
Well, it would depend on how ill they are. And I suppose if I really felt someone was succumbing to COVID-19, I would do a blood test and send it off to be tested. And then if they're still manageable to stay at home, I would have probably put them on high-dose vitamin D, vitamin D3. I would have given and made sure they're on a zinc supplementation. I would make sure that they're on a low-carbohydrate diet because sugars depress the immune system. I would make sure they drink plenty of water, and in much of the water they drank, I would put powdered vitamin C to drink liberally to get in, 4 to 10 grams a day, such that they would have a lot of vitamin C in them. And I would give them, we have certain nutraceuticals like elderberry and others that we know enhance the innate immune system of the body. Because really the approach that we need to look at here is building up their immunity, their ability to fight off a virus, rather than to send them home and just say, if you get to the point where you can't breathe, then go to the emergency room, the hospital. I'm here trying to build up their innate immune system. And maybe that's why all my patients have done so well, even my very ill and comorbid patients with COPD, emphysema, cancer, diabetes, heart disease, because my whole practice is based on not just treating a disease, but building up their health and their immune system. So I would say all my patients have lower blood sugars than the average American for their age. I would say most of my patients are already on a very good nutrient-based zinc multivitamin mineral. All of my patients are on a powerful antioxidant regimen. All of my patients are on a baseline vitamin D3. All of my patients are on iodine. So I think one of the reasons why I had no problems is all of my patients were immunologically well equipped, even in their comorbid states, to deal with this.
So how dangerous is COVID-19 then? Do you think it's possible that your patients or somebody who is immunologically sound, right, who's prepared, who's got the type of diet that you've just described, who's taking the right supplements and is not doing things that would compromise them any further, do you think they could encounter exposure to COVID-19 and have little to no effect?
Yeah. Yes, I think that's very reasonable. At least the question should be asked and explored. But for every one of the 49 or 50 White House news press conferences, except for the last ones in the past 2 to 3 weeks, the first time I ever heard of any nutrient being brought up really is zinc. So from day one, why wasn't the question how to build up the immune system if this is a virus? The question should also be asked, if indeed California, who gets a lot of traffic from the Asian countries, and I here have many Asian patients, and February 4th, I had one of my patients from Wuhan come to visit me. And she called to see, do I want to restrict her and so forth. And she came in and I examined her for other issues we had lab to go over. So it's not like I haven't been exposed, or Californians here aren't in a high exposure rate. And we have Los Angeles and San Francisco and Oakland and San Diego. So we have pretty dense population. In fact, our state has about 40 million people. But why did we do so well as a state? And I'm going to say to you, they're not asking this question, maybe because they don't want to look at this question, and that is, Californians as a group of people tend to be more health conscious. We as a people tend to take the lead in health ideals, such as eating more fruits and vegetables, or taking vitamins, or exercising, and these kind of things. And I challenge the news, or anyone who has the time to do this, because I don't, they should go to Rite Aid and Walgreens and CVS and Ralph's and Albertsons and all these stores and say, how did the vitamin sales go through the last 3 months? Was your vitamin C sales up? Was your zinc up? Was your vitamin D sale up? Were your multivitamin mineral sales up? And the answer is going to be yes. So did California do exceptionally well because we immediately, being aware of this, upped our immune level of defense and protection? And I'm sure that that is the reason why we did so well.
Yeah, it has a very California, relatively speaking, say, compared to New York or Washington, D.C. or New Jersey. New York is many, like, if I can do it, it's like 40. California is like, I lost it in the shuffle here. It's like 40 or 50 people per million. These are deaths. And so, I mean, I'm not here flipping these numbers around, but compared to California, or New York, which is like 1,100, it's like got 1,100 more people per million dying of this. So are you thinking that's just because Californians generally take care of themselves, have and their baseline health is better than New Yorkers?
Yes.
So
and you can figure it out.
Mm-hmm.
Ask Walgreens, ask CVS, ask Rite Aid, ask these businesses to do a report. It's a quick book, one-day test on what their sales are. And I can tell you my local stores have had all their vitamin C shelves gone, all the vitamin D gone. Mine have been gone. My suppliers, and I deal with the original suppliers. So I'm absolutely convinced that we need to talk about our innate immune system that originally encounters all types of pathogens every day of our life. And we're fearfully and wonderfully made, the Lord tells us, to deal with these things.
So I'd like to take that out of this whole thing. Whatever happens, I think it's important to be able to have a lifestyle. As Christians, if you're right with the Lord, you can walk with confidence in faith, because you don't have, like, your conscience isn't, you don't have a guilty conscience about something. So when you're right, it changes the way you interact. You have less fear. But as a Christian, you also have, if you feel like you're doing something wrong, you're afraid that God's going to bring something against you to set you right. And I think, in a way, if you're living healthy, if you're taking steps and measures to live right, then you can be more confident in not being afraid of having this virus get you, And so, out of this time and what's going on, in this phase of our history, is, I think, as we leave it, we can all figure out what we need to do to be more healthy and do those things, so we can make major changes in our lifestyles. But what they're doing short term now is they're putting everybody in masks, right? And that seems to be like, they're not telling anybody on the news, hey, you just need to get healthy. You need to get some vitamin D3. You need to get some zinc in your diet. You need to drink more water. You're not getting that. It was wash your hands and keep your distance. That was pretty much the mantra. And it's not a proactive measure. It's kind of a retreating measure. But we don't want to be afraid to engage with people. We want to be able to walk and shake hands with people, and we want to get back to life as normal, and the best way to do that is to be healthy. But what is your opinion on these masks? Do you think they're helping? Do you think social distancing is helping?
I think anytime you're ill, that you should cover your mouth when you're coughing, and if you're ill enough, you should stay home. Is there anything new about that? That's what Grandma told you. So quarantining is and has always been for the ill and the sick. Healthy people are not quarantined. And if you have a good immune system, you're designed to be able to deal with this. That county report that came out last week from Santa Clara County in California is just north of where I'm at. And in that study, they showed that the prevalence of seropositive antibody-producing people was vastly higher, on order of magnitudes 50 to 81 times higher than the actual measured positives that they had, which means that anywhere from 2.5 to 4.5% of the population in Santa Clara County has already seen, exposed, and made antibodies to this COVID-19. That means there's thousands upon thousands in that county who were healthy enough to apparently get it, not perceive it that they had it, or it was so mild it didn't bother them to contact anyone for help in their healthcare system, and they did quite well. So, no, I am not in favor of masks. That is only for the ill person or someone in a hospital setting who you have admitted and you do not know their diagnosis yet, and you suspect a highly contagious, serious disease. That's designed for a disease management in a hospital until you isolate what you're dealing with, not for the general public.
So the mask is, if I wear a mask and I'm exposed to somebody who's not wearing a mask, it doesn't make a difference for me. If somebody's not wearing a mask and they've got COVID-19 or they have some sort of contagious condition, if I'm wearing a mask, I'm still going to be exposed to it, in other words.
Absolutely. That these studies now are being done, that the prevalence in the population is already there. The exposure is there. We're not in containment at all, okay? And so they would say that we're trying to be in the flattening of the curve or mitigation phase. But we want people to be able to make antibodies to this and their immune system deal with it like it did last year. Were you worried last year? Were you worried in the flu season of 2018? I think there was a peak of 81,000 deaths for that flu in the flu season of the fall of 2017 to 2018. It was one of the highest deaths in the nation, 81,000. No, I suspected from the beginning that this was about the level of a flu and the seriousness of a flu. And I am seeing now evidence that there's quite a good amount of healthy people out there, and we are immunologically responding with antibodies. And, you know, I'm in that senior group above age 65, and I'm seeing all the patients. Your healthcare people in the hospitals are seeing them. You know, some of the hospitals are closed down. Some of the ICU, the emergency urgent cares, they're all being shut down because nobody's coming in to be seen. And there are other effects, of course, you know, from isolation. One of the best things to help your immune system is socialization. And things we know about infant mortality is if an infant isn't touched and loved and socialized, that baby will die from a lack of socialization and contact. So, you know, we need to be asking these scientific questions. When did we ever isolate the healthy? You know, mm-hmm. When did we ever quarantine the healthy?
So if you're just joining us, we're speaking with Dr. Rita Ellithorope, and she's a medical director of Integrative Medicine. She received her medical degree in 1982 from the Chicago Medical School in North Chicago, Illinois, and she completed her residency in family practice at Womack Army Medical Hospital. I throw Army Medical in there, but I guess Womack Army Hospital, and that's in Fort Bragg, and that was in 1983. We got a lot of information on her. I could go on. As she's a guest faculty member at Capital University. Is that correct?
That was teaching integrative medicine, Eastern medicine, alternative medicine techniques. That was in the Washington, D.C. area, and that school has now shut down.
So besides being, so Eastern medicine isn't considered allopathic medicine, then, is it?
No.
Yeah, that's antithesis, right? It's the right. Okay, well, that's interesting. There's a lot of things I'd love to talk to you about, and getting to know you a little bit more just by hearing what your opinion is on things. One of the things that people talk about is 5G, right? And there's these conspiracies that 5G is causing it. Now, I don't think it's good. My real estate agent, when I was looking for a house, he's like, hey, you don't want that house. It's right under the power lines, right? He's like, you don't want to be so close to the power lines. And I said, yeah, you know what? Yeah, let's skip the houses next to the power lines. And, you don't want your Wi-Fi next to your bed while you're sleeping. So there's definitely things where it can affect your health. Now, some people are speculating because correlation does not equate causation, and that there could be, in these densely populated areas, people exposed to more types of people with different immune systems, and different germs are exposing people. But it's also maybe where these 5G towers are going up. Have you heard any of the speculation or any of the talk that 5G could be compromising people's immune systems to make them more susceptible? I think that might be the argument that we've heard.
My research, the time that I have for studying, goes into looking for good scientific studies on the safety of these things, electromagnetic energy. And what I've seen so far just makes me have more questions about its safety. I'm not convinced that these electromagnetic waves are safe for the human. One of the things is the electromagnetic wave of 4G is at a certain frequency and hertz cycling that makes it kind of resonate with the electromagnetic frequency of the water molecule. And so when you turn your microwave on, you are turning on a designed energy frequency that compatibly irritates and syncs with the water in your food to make it jiggle, and that's how it heats it up. Okay? This new 5G level of frequency is much tinier than the larger frequencies of the 4G, and this seems to resonate with oxygen, the molecule of oxygen. So I'm concerned about that because these are human required physiologic elements that a human being, every cell has to have. So I don't think that the studies that I have seen are sufficient for me to endorse their use. And I have concern, yes.
It's one of those things that we really can't do anything about anyway. You know, I mean, they're gonna set up. We have our cell phones, we have our Wi-Fi, and we do that. And by having the subscription to the cell phone or the plan, you kind of are giving consent, and they're doing it anyway because I think there's an agenda to make technology. I believe they want to be able to have a kind of a what's the word I'm looking, like a cyber grid over the whole world, so they can be able to pass information from all around. And I believe that's something that they've been moving through for years. Now, regarding the government's response, you've already said that there's other ways that we could be handling this. What do you think about the government response? Some people think that this could be a power play on one. You know, like the whole thing was, as soon as they saw the opportunity, they took this as a chance to push forward some, one world agenda type of stuff. But then also it's at more local levels. You know, some churches have been shut down, some businesses have been shut down. So from the micro to the macro, the governments have been responding in ways that people are just thinking is overacting. What's your general opinion on that as a doctor?
My people perish for lack of knowledge, lack of wisdom. And I believe the more that we don't raise our children to fear the Lord God and to take on the personal responsibility for their behaviors and for their responsibilities to their fellow brother and sister, their neighbor. If we don't raise God-fearing families, then there is no hope. There is no hope. And whether it's sexual transmitted diseases that harm them, drug and substance abuse materials that harm them, fast driving that harms them, being addicted to video pornography and the blue light of the screen late at night, poor sleep cycles, the inactivity of their body. They're being programmed to eat and eat endlessly, these valueless, processed, cheap foods that you can have home delivered, whose shelf life not even rats would eat, like boxes of cereal and stuff like that, and the perpetual surviving McDonald's burger and fries that is now, 20 years old under the cake cover. So what do I think is going on? I honestly think we have to teach the Word of God to our children. I am an evangelical New Independent Fundamental Baptist, okay? I believe that when a person realizes that they are responsible not only to God but to their neighbor, then they'll start getting educated and they'll start trying to defend the defenseless, like the unborn, defend the child from vaccinations that are not well studied for their safety and efficacy. They'll start defending their God-given rights that he allowed us to defend under the Constitution as well. So as doctors, we are facing a conglomerate machine. There is a science academia. There is a big pharma. And this science academia and big pharma and big business, medicine has become a machine, and the education process and selection process for doctors has become a machine, well advertised, managed system, which means it's very hard to find truth anymore. We think just because there's a big name like Harvard or Johns Hopkins or the NIH or the FDA or the CDC, we are programmed to think only truth comes out of these places, right? We are knee-jerk Pavlovian taught that only truth comes out of these places. And yet I know case after case. I'm prior military for 9 years on active duty as an ER doctor and a flight surgeon. I have personally encountered the corruption of the government healthcare system. And so do I trust anything on it just because it has a CDC on it or a FDA or an NIH on it? No, I do not. I'm published myself. So I have published on what it takes to help restore the energy and the health of the cell membrane. And I think that has benefited my patients. It certainly has benefited me, because if I'm able to publish in peer-reviewed scientific publications, I understand how to read scientific papers. And I won't be drawn away with fatigue of reading. There's an old idiom out there: doctors aren't paid to read scientific papers. Only interns, or what do you call these, research graduate students are paid to do that, okay? But I must spend maybe 20%, 15% of every day screening and scouring the internet and the research on this, okay? Because I am a scientist. In the old days, the doctor had their microscope. The doctor in the old days, and when I was trained for getting gonorrhea, for instance, that's an anaerobic bacterium. It can't be around oxygen. So when I would do a swab for gonorrhea, I would immediately light a candle, get a mason jar, and then I would put my petri dish in that where all the oxygen was taken out. I mean, that's how old I am, But I'm telling you, I was trained by doctors who had their own labs, And I have mine, therefore. So I have my own lab. I do my own research. I publish. And Dr. Angel, who was the editor-in-chief of the New England Journal of Medicine, and I think she stopped that position in 2006, she, as she was leaving, and I'm going to paraphrase this, but her general statement was she was sad and remorseful to have to say that the majority of the papers submitted to the New England Journal of Medicine were of questionable scientific accuracy and efficacy, okay? More than half, So, excuse me, I don't drop in awe just because it says the New England Journal of Medicine or the NIH or the CDC. The tire meets the road here in my office between my patient and me. And there's a very special bonding here. My patients look to me for authenticity, for integrity of work and competency. Otherwise, they wouldn't come. They won't come back. And I will stay here no matter what. I've been at this one location 20 years. A little over 20 years, and I'll stay here until the Lord allows me, to go to heaven, because I have no intention to quit doing research or quit working. But today's methodology is, I'm going to buy a house here, or my husband's going there, I'm going to stop working here, and by the way, I asked my husband permission to become a doctor before I went to medical school. Okay, I was a Christian, and so I was not at all a part of the women's equal rights liberation movement of the 1960s and 1970s. And I asked him permission, and then he was that was in the Vietnam era, and he was on active duty. So while he was gone, I just took my Bible in one hand and my chemistry, biochemistry, physics in my other hand, and I just stayed in the university and studied and studied and studied. I enjoyed it because I was in my father's labs at Armor Food Research, so maybe God had something, planned for me to like this kind of work. But I am not a women's liber.
Oh,
I am a grateful person to be able to serve my Lord and share the gospel with each and every patient that allows me to give him all the glory.
That's wonderful. We're talking with Dr. Rita Ellithorope, and she is she's been practicing medicine for how many years now, Doctor?
About 40.
40 years, and she's just been sharing with us just general health suggestions and how she's responding to the coronavirus outbreak and what she recommends. We're also, during this episode of Framing the World Live, we're going to be doing a drawing or several drawings for whoever would be interested in winning some free prizes. We have a whole list of things that we'll go over shortly after. But the way you get involved in this and become a potential winner is by buying anything at the Framing the World store during this broadcast of Framing the World Live. So you can go to framingtheworld.com and purchase anything there, from a citrus peeler to a t-shirt to a movie to a toothbrush or some DMSO. We've got the Deported DVD there. We got some CDs. You can purchase anything, and your name would be included in one of the few drawings. How many drawings, Paul, are we going to do? Like 8 or so?
Yeah, we're giving away some T-shirts. Here, let me just go through it. So we're giving away the Fluoride Poison on Tap T-shirt at the end of this stream. We're giving away the Don't Tread on Us CD, Fluoride Poison on Tap movie. We're giving away a POH toothbrush, which is awesome. We're also giving away some DMSO and a citrus peeler. So we're giving all that away at the end of the stream. Make sure you stay till the end. And also support us on Patreon, guys. All you have to do is donate $1 a month on our Patreon account, and you'll be entered in for a chance to win that.
Terrific. And so, Dr. Rita, you kind of tied some thoughts together there. I don't know if you intended to, but it leads into my next question. But the problem is that people are not dealing with each other in a spiritual type of way. We're not taking care of our neighbors. We're not doing the things that please the Lord. And so therefore, doctors, when they're sitting down with their patients, they're not seeing them as their neighbor. They're just seeing them as maybe something else, as a customer who's paying and they're getting a service, or, I don't know how to look into the mind of doctors. But do you believe that a lot of today's medicine, and you mentioned the journals and what's being published, and that there's a lot of credence given to what's been published in certain journals or what comes out of certain hospitals or medical schools. Do you think a lot of today's medicine is being pushed by the pharmaceutical company?
I don't only think it, I know it. And the pharmaceutical companies have marketing engineers and very, very well-paid, forward-thinking marketers. And you can only develop so many blood pressure medicines, so many antibiotics, so many reversions of pain relievers and stuff. And they want the market to go worldwide. And these uses have limitations. The patent runs out on them. And so the income of the pharmaceutical industry is teetering somewhat, in my opinion. And so what would be a wise financial maneuver for the stockholders of pharmaceutical companies would be find an area that you could have a recurring consumption of a pharmaceutical worldwide. And vaccinations fit that definition, demanding and working through lobbyists and other organizations that you would finance, donate generously to help support the promotion of vaccination as the one-shoe-fits-all solution to making the world. They've even linked it to the climate change, making the world a safer and healthier place through all these many, many programs. So it isn't that this is illegal. It's just what is happening to the world through greed and lack of moral constraint. I mean, I know professionals who would argue that there's been corruption in vaccine research and there have been cover-ups. So what am I supposed to do as a physician and a scientist myself, knowing people like this, and I believe them, you know? I have my doubts and my concerns that vaccines are the solution, the one shoe fits all, but I'm telling you that's where it's headed, through the World Health Organization, through the CDC. This is going to be the thing that they're going to push, is vaccinations for everything. And they have to market to you to make you yield and ask for it, okay? So I think we physicians are undereducated in science. These doctors get into a small box of medicine. Maybe they're a ear, nose, and throat doctor, or maybe they're just a neurologist, or maybe they're just a cardiologist, or maybe they're an orthopedic, or maybe they're a dermatologist, or they're a gastroenterologist, or they're a gynecologist. I mean, they have all these compartments. And yes, I need my specialist. When I have a problematic patient, I need to get on the phone. I need to present the case. Just like in medical school and residency, I need to share and get help from a specialist. But I don't need 1,000 specialists. I need 1,000 good doctors keeping everyone healthy, okay, preventatively, so the need for the healthcare dollar goes down and the well-being of the people goes up by building your innate immune system. That's where what I am for. But guess what? There's no money in that. Guess what? There's no investors in that. Okay? So we do right things and correct things, not because we make money at it necessarily, okay? But pharmaceuticals and stockholders demand that there be projections and fields of marketing that the industry will move into. And voila, we have arrived at now world pharmaceutical vaccination propositions. And how convenient to have this potential pandemic to frighten everyone, even though we're learning that the mortality rate was vastly overestimated, and in fact is at the level of the yearly annual flu. But that's where we're headed, folks. And if we don't raise moral people who are not just driven by a profit margin, then this must happen to society. This is the devolving, following the greed and following the academic lookaways, even the research in the HIV for AIDS, right? That research, you know, the Dr. Gallo, who was alleged to have found originally back, see, this is when I was in getting out of medical school, he was purported in the United States at the CDC to be, we found the agent that causes AIDS, the virus. And Dr. Gallo out of the CDC was getting news briefings on this. But in fact, it was a Dr. Montagnier in France, okay? And it turns out many years later that, at least back then, there was an ethics board that punished Dr. Gallo and criticized him for incorrect ethics, let's say, in the hallowed halls of the CDC and research. And so, folks, if as recently as AIDS, there was greed and pride, and I want to be the person who gets the Nobel Prize. It's in us all. There's none righteous, no, not one. And you have to keep an eye on your industry and the people who are in medicine, in making your car, in making your food. There has to be ethics there.
Well, maybe I don't have much hope that that's the direction we're moving, unfortunately. I believe that the people who are ethical have to be, or those who are of faith have to be more salt and more light. Like we as individually, like we have to stand that much stronger than anybody ever has, maybe in this time, and that the world is just going to get darker in that, and it just compels us to take that much of more of a stand and to speak the truth that much more. Now I've got a couple random questions. I've taken some notes and we've gotten some questions from the chat. But do you know? Can you just explain? And back to the coronavirus. Can you talk about the different types of coronaviruses?
Family. Now, I am not a virologist. I am a generalist. But I'm well versed in discussing this in that that's a family of viruses. Just like you have phylum and family and genomes and species and stuff, the same as in the world of viruses. And there is even a higher hierarchy over the corona one. But even this one called COVID-19 has already had quote-unquote mutations in the nucleotide pairing in the assays that have been done by PCR testing, so that we can even regionally look at, this looks like the mutation COVID took in India, which is different from the mutation it took in the United States, which is different from the one it's in Europe. Do you get the point?
Do you think they're natural mutations, or do you think these are manipulations that are done in laboratories?
Well, if you ask Dr. Montagnier, who got the Nobel Prize in 2008, I think it was, for discovery of the AIDS virus, okay, the virus that causes AIDS, his own statement is that this is a manipulated virus. This is a chimera or a generated thing. So I am not a virologist. I don't splice and piece things together. I don't go chase bats and look at because they're a very natural reservoir of coronaviruses, but many animals have it. So all I can do is take men like that who have great integrity in their field, and if he's publicly saying he thinks this is a generated, manipulated virus, I have to then be left with a question, and so forth. But what I do know, and what I can be strong on, is that it has changed as all these viruses and bacteria that develop resistance to antibiotics and stuff. There is a degree within the species of reacting to their environment too, right? Mm-hmm. So I'm very curious. So he's not feeling that this is something that is jumping from an animal to a human, but that it was designed that way. I'll never know, but one thing I do know is that we can build up a great immune system to fend that off, and that's where I'm going to pour my heart and my soul, because it's what I can do.
Right.
I can read about vitamin D research. I can study vitamin A. And why don't I get money to do that kind of research? They won't fund it. And that's another way that they direct the whole field of science, by keeping doctors like myself having to self-fund. I mean, I've gone to wealthier people and patients, and I said, I'm trying to do research on, cell membrane and fatigue, for chronic fatigue, natural hormone therapies, anti-aging. But nobody wants to give me the money for it, okay? Because who's going to make a lot of money on learning how to eat better or take a special nutrient? But if you have a group of philanthropists, very wealthy people, and you get them in a club, and you say, I'm going to have a picture of you cutting the ribbon to the new Wuhan Center that we helped build in Wuhan, China, because you help donate to it, let's say. I don't know if that happened. I'm just, confabulating that. But they get them in these pictures and they get their names on plaques. And what happens is there's this good old boy, thing. It isn't necessarily illegal. It's just whatever makes the money, follow the money is what you have to do. So these philanthropist organizations and these marketing organizations, and don't you think that they would want to be, let's say, promoting commercials for their medicines on TV? Well, that never happened before, right? And so when commercials eventually said they marketed and they lobbied for it and they got it. Well, maybe there might be some congressmen and so that maybe are getting on the boards of maybe some of these things. Maybe some of the people who are on the boards of the CDC, once they supported a vaccine research program, when their tenure was done, they get put on a board and have a multi-million-dollar position, which is peanuts to a multi-billion and trillion-dollar pharmaceutical future. So you see, nothing necessarily is illegal. You see? Mm-hmm. I know, in fact, that the head of the research on the MMR vaccine, the whistleblower, William Thompson, was the head of that research study at the CDC. William Thompson did this, and it came out in 2004 in the Journal of Pediatrics that this was told to be not associated with autism. And then years later, Dr. William Thompson, the virologist, couldn't bear it any longer. His conscience came to him, and he admitted to the data that was thrown away, numbers that were refiddled, and it was indeed associated with autism. And I know that the head of the CDC that year, then, because Merck was working with the MMR vaccine, I know that she got a position on Merck's boards.
So, if you were the Surgeon General, and you're not in the club, so I doubt you're going to get the job. So
yeah, that's right. You see, we thought, and you probably think that science is about a lot of individual men and women doing science and thinking and challenging the hypothesis and testing it.
I know that's the definition of science.
That's not it at all in today's science.
Right.
It's industry-designed research for the outcome that you want. And I was actually in North Carolina, in Raleigh, and I would actually see research advertisements that said, "We'll get the results you want." And I'm a researcher, besides being a doctor. That's unconscionable to have advertisement that says, "We'll get the research you want, the results you want," rather. That's like whores having their advertisement at the airport saying, "If you're not busy tonight, call this number," when you get off the airplane. That's unconscionable, right? To see whore advertisement on billboards coming off the airplane. Well, how is that different from that in Raleigh when I was going through there to the Army medical centers and Raleigh research to see, we'll get the results you want? No, you have to understand, when there's so much money, you get the TV advertisement because you lobbied for it. And just you argued your arguments so beautifully because you had enough money to have enough lawyers to argue it for you. And they wouldn't stop. Even the Bible talks about the judge that finally listened to the woman who kept on petitioning him, and he said, "I don't have to do this, but because she keeps on bothering me." So there's an actual legalese of just constantly pushing and lobbying for something because it's not technically illegal, okay? But the ethics of selling, advertising medications on TV is immoral. It'd be like, it's immoral, because it's generating a bunch of people to go to their doctor and say, "I saw on TV this, can I have it?" That's not right.
They get a lot of samples, the doctors do, and I know I've heard of pharmaceutical reps that there's benefits that go to doctors if they're going to to help them be part of their spreading of a new sampling, right, of those types of things. But we're talking with Dr. Rita Ellithorope, and she's, we've been talking about the current situation with the COVID-19 crisis, but just general health and what we can do about improving our own immune system to make sure that if we encounter this virus that we can just blow through it and not have any issues. And also we've talked about some of the things that are happening kind of ethically with what's being pushed along the narrative and how people are responding. So if you were the Surgeon General, Dr. Rita, what would you do right now? Would you just end the lockdown? Would you just start pushing out, would you just be dropping off the vitamins and the treatment? Like, what if you could just get on the news as a doctor and they got rid of this Fauci guy and they said, you know what, we're serious about fixing this problem. We're not pushing for this vaccine agenda, which we all know they're doing. They're taking this and they're pushing their vaccine agendas. Whether politicians are involved at any degree, or the media is involved. Who knows what's happening exactly? But we know that these things happen, and as you've mentioned, there are people who are doing it for the love of money, and there are people who are just deceived because they weren't raised to fear the Lord, and even our neighbors, the people that we encounter every day, are they don't fear the Lord, and this could be something that God has brought about just as a result of that. You mentioned all of the bad things that happen as a result of not living righteously. Somebody has a question about herd immunity. But besides that, what would you do as the Surgeon General? What would you roll out tomorrow to deal with this issue?
I would roll out knowledge, because Proverbs extol knowledge, and with knowledge, wisdom. And I would teach these people on a weekly broadcast about the value of vitamin D, a low carbohydrate diet. What's so funny is Bill Gates some of the biggest investments he has is in corrupting companies like Pepsi-Cola, Coca-Cola, fast food restaurants, and the like. Don't tell me that he is really worried about global health. Excuse me. That is a very cool marketing plan. It's like, your actors, they have this image on TV but for a persona, but their real life story is a horrid mess. No, Bill Gates is supporting things that tear down the immune system. So every way and any way you can uphold the Word of God and say, if God says we get a good life from knowledge and wisdom, and that from the Word of God, then I'm going to be right up front and say that we need time to humble our hearts and become teachable, okay? Maybe the men today have become frightened because even though they might be handsome and tall and strong and young, yet they're afraid of a little virus coming at them. Let me tell them, just like Elijah told his servant when all the Syrians were surrounding him, he said, Lord, open their eyes. And he could see all the chariots and stuff. They that are with us are more than that, are there. So I would begin as Surgeon General with education, knowledge. I would teach them how magnificent their innate immune system is, how magnificent water is as their number one nutrient, to drink water. I would teach them how magnificent a good night's sleep is for their immune system. I would teach them how excellent it is to eat a low carbohydrate diet. And I'm telling you, I'm here every day. I've never taken a vacation in 40 years. And those who love their work have never worked a day in their life. I love what I do, and I love my patients. So they come in here all the time, and I'm teaching them, about getting a good night's sleep. Did you drink enough water? Are you exercising? Are you moving your bowels? Are you eating a low-carb diet? And everyone's sitting there, I eat a great diet. I eat a healthy diet. Then I do their lab, and on their lab, they have a fasting blood sugar of 96. and their doctor said it was fine before. And they have a fasting hemoglobin A1C of 5.7. And their doctor said it was fine. And no one did a fasting insulin on them, a fasting insulin. And they come to me and I tell them, you are not fine. You are pre-diabetic at 22, sir, ma'am. And you're on your way to the diseases that high starch, carbohydrate, sugary, latte, frappe, whatever those drinks are, your sugar drinks, even spinning up these smoothie drinks are so full of bananas and fruits and apples and stuff that it becomes a sugar fix that replaces their Coca-Cola drinks. We are deceiving ourselves. And it is no wonder that the life expectancy is now starting to come down because of your generation. And so I have to look like the big old bad mama doctor here, but I love my patients and I teach them and I tell them, you're not cutting it here with me. I will not tolerate a fasting blood sugar above 85. I won't tolerate a fasting hemoglobin A1C above 5.2. I won't tolerate a fasting insulin above 3. But the ranges on my lab paper say I can be higher. And I said, and that lab is a conglomeration of committee agreements and population samples. It has nothing to do with the truth. And we have a tidal wave of obesity, cardiovascular disease, diabetes, and many other chronic metabolic diseases. That lifestyle will change alone. And I'm not going to make money writing you a prescription on it.
Mm-hmm.
That's why I need a relationship with my patients so they know I'm the real deal, that I really care. And maybe that's why all of my patients, I'm so proud of them. I haven't had any, even of my severely ill, to become, succumb, to this COVID-19.
Well, Dr. Rita Ellithorope, she is a staff physician and the director of women's studies at Whitaker Wellness Medical Clinic in Newport Beach, California. So how far are you from Los Angeles? Or is that...
Yeah, that's old.
That's old. Where are you?
Yeah.
Where can we find you?
Tustin, California. There's the ocean, and then Newport Beach, and then the next town in is Tustin. So I've always been where there was less money. And Oofaloosa.
So you've just got to practice there. What's the name of the practice?
Tustin Longevity Center. And my website is
I see it.
Yeah, tlcdoctors.com.
It's like Dustin, but with a T.
Yes. Yeah. There you go, like your name. There you go.
Exactly. I can't forget that now. So we've got a question about, so your website is TLC, what was it?
Doctors, DOCTORS.com.
TLC Doctors, Tender Loving Care Doctors.com.
Yes, that's Tustin Longevity Center,
Mm-hmm.
Tender Loving Care, Together Loving Christ.
Right. That's awesome. So we have a question about the herd immunity that is said to be happening in Sweden. Have you heard of that?
Oh, yes.
And so apparently they haven't done any kind of lockdown there, and that they're just moving along with business as usual. Do you believe that narrative, that they're actually exposed to it just as much, and maybe they're just a healthier type of society, and they don't have the same type of vulnerabilities that maybe you'd find in New York or these other, like Italy or something, and so that they are able to get a herd immunity, as they call it?
Well, if you look at Sweden and then compare it with some more comparable place, their neighbor like Norway, okay? So they have a similar kind of lifestyle, socioeconomic lifestyle. And Norway did the typical shelter in place, these more draconian restrictions. And Sweden did a much more liberal. Now, they did let the children, the kindergarten all the way through, I think, junior high, go to school. But their seniors, they kept isolated. So they were much more liberal in keeping shops open and cafes and things like this. And if you look at their death rate per capita compared to Norway, that did the absolute shelter in place, they're almost identical. Now, their populations are different. I think Sweden has 10 million and Norway has more like 5 million people. But if you look at their incidence of death, you're going to see that they're basically similar, their rates of death. So I am convinced that letting healthy people work and take care of the economy and provide the things needed for living is the right way to go every time. And you cannot restrict the healthy people and their liberties. You must restrict and quarantine only the ill. And that's just where I'm going to stay until I see otherwise. And this downturn or flattening of the curve and the good results in California, to me, are just as much due to all the sales of vitamin D, vitamin C, the zinc, the multivitamins, as it is any face mask and social distancing.
Oh, yeah.
Okay.
My microphone button guy is sleeping on the job, maybe. So I've got a question about germ theory versus terrain theory, right? Because I've heard people talk about this. Can you just give us a quick, if there is such a thing, a quick, because that goes all the way back to Louis Pasteur, doesn't it?
Right.
How would somebody understand that?
Well, Pasteur is like one of the scientists today, and maybe he was more sincere because I think it was more novel and less politicized and financed back then. But he found the bacterium that he thought, caused a certain disease. And this finding of the bacteria made him famous. And on his dying bed, it said that he agreed with his competitor colleague, and I forget his name, Pasteur or whoever it was, and he said he was right. The terrain is everything. The pathogen or the bacteria is nothing. Meaning, his friend, colleague in science research was saying your immune system, your water, your sleep, your healthy diet, your low-carb diet, all these things, the hygiene. In fact, you could argue that we should actually applaud our plumbers and our, our sanitation experts, for all of our health, because it's sanitation that correlates with the demise of all these community-acquired diseases. If you go back to even 1900 and you look at, scarlet fever or rheumatic heart disease from the strep bacteria, if you go to mumps, measles, chicken pox, you go back to pertussis, you look at these and you find that long before there was ever a single vaccine of any import at all, because I know there was that smallpox scratch test from the cow pox back in the late 1700, early 1800. But the vast majority of science shows as civilization and nutrition and sanitation improved, all these diseases went away even before the Salk's polio vaccine.
Mm-hmm. So I also have a question, just a personal question. It's anybody can probably benefit from this question, but I have a daughter who's now 3.5, and back in November, we had to take her to the emergency room because she had a fever and it wouldn't go away, and they thought she had strep, so they gave her antibiotics, and we felt like after 3 days of a fever with the 3-year-old, so we took the antibiotics, and then it didn't go away, and we ended up going to a different hospital who said she had appendicitis and that she'd ruptured her appendix, and she had to have her appendix removed. Now, I know some people say, and even the doctors say, they don't know what the appendix does, but throughout that event, my 3-year-old daughter, who just turned 3, she was on a lot of antibiotics during that time, and so she had her appendix removed at 3 years old, and she was on antibiotics, and then maybe 4 months later, she had another fever, and her throat was really swollen, and the doctor looked at her throat, and she had really white tonsils, and so they said that they felt she had strep. So again, she's on another round of antibiotics, not even 3.5 years old. So having gone through that, one of our concerns is we hope that, we can get her back to having the same type of biome in her gut and those types of healthy things for her. Now, how far back was she set in that, she did almost, 10 days twice, if not more, twice of antibiotics, because the second batch of antibiotics weren't effective. We had to switch and go to a different antibiotic. So what would somebody do? What can we do? We've got probiotics, the yogurts, the kombucha, the sauerkraut, all of those types of things in daily doses of those, raw milk, and that's what we're doing. But how can somebody who feels like maybe they're behind the curve, forget flattening the curve, you're behind the curve on these things. What can somebody do? What can we do? What can our listeners do if they feel like their immune system has been compromised because of maybe that type of experience? What would you suggest?
Well, you did some very excellent things, but my patients in general think they are on a low carbohydrate diet when in fact they're on a lower than terribly high carbohydrate diet, because we're around starch, carbs, carbs in our drinks, carbs in our gum, carbs everywhere, carbs at the gas station. So we're in a sea of sugar, which is immunosuppressive. So I would be extremely careful about the diet of our children. They don't need all these snacks that are packaged. Give them the apple, give them some carrots, things like that, and strawberries. Don't be giving them all these goldfish and little animal cookies and foolishness and apple juice and orange juice that are full of sugars. Let them eat a sliver of apple, not take the juice, because that is a tremendous immune suppressor. And that also will promote yeast and candida. And though that produces neurotoxins and toxins itself, is immunosuppressive. One of the things we do here at Tussin Longevity Center is we do forward-thinking tests like a complete digestive stool analysis that actually looks at the plethora of bacteria in the stool, looks at the digestion components of the stool, looks at inflammatory markers of the stool, looks at, like parasites and ova that are in the stool. And so it's a complete digestive stool analysis, so you can actually measure this. Now, whether or not the insurance will pay for it, how interesting it is that many and oftentimes the insurance company pays nothing for preventative restorative medicine. Okay? But anyway, so we have these capabilities. We have blood tests that do micronutrient assays, so I can look at the vitamin A, the CoQ10, the lipoic acid, the vitamin C level, the vitamin K2 level, and all these very wonderful micronutrients. So there are tests that you can do at clinics like mine, and I'm sure there's probably wonderful ones there near you in the Phoenix, Arizona area. There is an organization that I help teach at. It's called the ACAM, the American College for the Advancement of Medicine. So I've been a member and a teacher there for chelation therapy for many, many years. At acam.org, acam.org, usually has forward-thinking doctors that are opening their eyes to complementary ways to help their patients, and one of them is chelation, but there's many other things that are taught there. If you put in acam.org and say find a physician, you'll probably find a more sympathetic, a more informed doctor than a standard allopathic pediatrician, family practitioner, internal medicine doctor, because you don't get this training in medical school. And my poor colleagues in medical school, I don't fault them. They had no idea what they didn't know, okay? They had their preventive medicine class was probably a half day on vaccine schedules, thinking they're doing preventive medicine, getting taught about vaccinations. So you got to forgive them, but at some point, these physicians have to start perceiving that their children are getting sick and their aunts and uncles are getting diabetes and obese and chronic degenerative diseases sooner, and they've got to open their eyes. So at some point, they become culpable as to why aren't they looking elsewhere. Not in replacement. I will use an antibiotic if it's necessary. I will refer for, cardiology consult for, unstable angina and get the angiogram and hospitalization. I'll do the standard medicine. But hopefully I can prevent that with the way we manage patients here. But if I need to, I will use my consults. But back to your daughter. So yes, probiotics. Now, the thing about milk, I'm not a dairy supporter, certainly not of the standard dairy that's pasteurized and homogenized and turned into an inflaming, broken up piece of white fire water and white fire bricks called cheese. Raw dairy, I'm more tolerant of. But you see, in our country, I tell my patients, we've rotated. God has the day and the night. He has a day to be born, a day to die. That he has the whales migrate. It's fun to see the whales out here in migration time. Birds migrate. The fish migrate. Planting is seasonal. Not everything plants at the same time. God is a God of this magnificent variety. And so I try and teach my patients that you are being subliminally trained to eat the same food over and over and over and over and over and over again, okay? So you're being trained that you should eat breakfast and it should be a cereal, and you're being trained to stop at the Subway or McDonald's or Del Taco and or even Chipotle. You get these patterns, right? And that's not what the gut needs. So we teach a more simplified one menu day, and we teach a rotating diet. And what I mean by a rotating a one menu day, we teach that whatever you make for dinner, make enough of it so it's your brunch the next day. And we teach eating only 2 times a day. Because your gut is an organ that has 80% of your immune system here. And if you're constantly feeding it, your immune system is watching your food all the time rather than allowing the immune system to do a more proper surveillance. So if you eat a more simplified, less wild and spicy, crazy entertainment diet, and you eat a more, like our forefathers, I don't think our Lord and Savior Jesus Christ, had, fish for breakfast and with eggs, and lamb for lunch, and what would be another thing?
Unleavened bread.
Yeah. Yes, he wouldn't have all this variety. They wouldn't have that much variety. They would have their meat day because that's what was on sale, or their fish, and they would eat that. There was no refrigeration, and so they had to eat it all up. So whatever was left over from dinner last night, remember in the Bible it talks about the second day you may eat it, but on the third day it's a contamination. Well, that's based on food rotting, And what's interesting about food rotting is my father in Armor Food Research, he was hydrogenating the fats of the foods so that it would extend the shelf life for the manufacturers to do more shipping of food long distance. And he would have to manipulate the spices in the food and hype up the sugar and the or salt taste so that you wouldn't sense the deterioration of it. And when they hydrogenated it, it stopped the essential human fatty acids from combining with oxygen, because that's what's called rancidity, where the food is rotting, okay? So we're eating a bunch of cardboard, essentially, which is valueless. And that's why we're all zinc deficient. And maybe with all these chemtrails and the minerals in the sky, They have aluminum oxides and barium oxides that they're spraying in the sky that redirect the light from the sun, the wavelengths, in this argument for alleged global warming. It used to be global cooling when I was a young person, but now the flavor is global warming. But either way, those aluminum particles and those barium particles are landing on your organic fields and so forth. So we're becoming toxic with toxic metals because those are toxins. And where was I going? What I'm trying to point out is the food system is corrupted. Fats have been hydrogenated to extend food life. So even if you go to these fast food restaurants, they will use things that have long shelf life. And they'll put spices and flavors in them to get more use out of them. So we've got to teach our people to cook at home, cook more humbly, eat more simplistically, and not eat as many carbs, and you'll have a better immune system, less diabetes, less obesity, and heart disease, and even cancers.
I hope our listeners are listening to that, because that's good advice for everybody. Somebody has a question about spicy, because they heard you say spicy is bad. So having hot sauce on your food isn't a good thing?
If you have to do that every day, I'm saying that that's probably a problem for your immune system, and you're probably going to build up an immunological antibody to it. So I'm not saying spice itself is wrong. I'm just saying if you think you can eat whatever you want every day of your life because I want it, well, you're wrong, because your immune system is a little bit delicate. And if you eat that same food and that same spice day after day after day after day after day after day, I'm telling you, you're going to develop an immunoglobulin to that spice or that food. And how do I know this? Because I've been doing this for decades, and people's jaw drop on the floor that they're making IgG antibodies to avocados, or they have IgG antibodies to eggs, or to spinach, or to coffee, or, something you're doing over and over and over and over to excess. So, no, spice is fine, but where's the balance and the humility? Why don't we eat food so that our day is about our work and the people we serve, not about what we eat, and it's always a reward, Why don't we let food be food, and then on your birthday, you can have a treat, and on your anniversary, you have a treat, and on Thanksgiving, you have a treat, and on 4th of July, you have a treat, and on Easter, you have a treat, and on Labor Day, you have a treat. Do you see? We have been programmed that this little body of ours deserves its entertainment, food, sugars, and food spices, and we're killing ourselves. And we're inflaming our gut. Just because you can't see the rash that is along your gut doesn't mean it isn't there.
Wow. Well, I think we've probably gone over our time that we had scheduled you for. I think we've done a really good job of just really getting into it. So we thank you very much for coming on the show with us, Dr. Rita. I really enjoy talking with you. Somebody did ask if you took any patients by telecommunications.
Yes, we do. We do have teleconference. We do hope that you make it here so that I can physically see you. But yes, we do. And I'd be happy to come back again and answer questions and just respond. Excuse me. So, thank you, and my son wants me to come home for dinner.
Okay, good. I hope he's not making anything too spicy now.
Yeah, there you go.
Yeah, so since you did us the great pleasure of speaking with us, we would love to continue this conversation at another time. As you'd mentioned, if you were the Surgeon General, you would want to do something for the people. Yeah. And I think we could be a great place for you to do that, and I think our people need it, and once it gets on the internet, we can pass it around and share it. Excuse me.
Sure.
But before you go, would you do everybody the service of knowing, how they can find out more about you, and if there's anything you're promoting. I know that you had done a documentary in the past with Pastor Mejia. Are you guys planning on doing something again?
I think so. If you go on the YouTube and you put in the name of our medical clinic, it's called Tustin Longevity Center, YouTube. And when you put that in, my channel will come up, and then click on my logo. There are the caduceus there. Click on that, and then my personal channel will pop up, and then hit videos, and you'll see all kinds of topics there, from pregnancy health, nursing mothers, irritable bowel, leaky gut, cancer, heart disease. You'll see all kinds of videos.
And has you lately talking about the COVID-19 updates? Is that the right channel?
Yes.
Okay.
Yeah, there's quite a few. But if you scroll down, you should see many more.
Patient testimonials. Okay. Well, I'm going to go ahead and share that with our people in the chat. So that is Tustin. It's like Dustin with a T, Longevity Center there at YouTube. And your website is tlcdoctors.com. And we're speaking with Dr. Rita Ellithorope. I've been saying that right? Ellithorope?
Uh-huh.
All right. And so we're so grateful that you join us, and we don't want to take you away from your dinner plans with your son. So is there anything you'd like to say in parting?
I want to bring up a scripture. If you go to Isaiah chapter 3, verse 11 and 12, it reads, "Woe unto the wicked, it shall be ill, for the reward of his hands shall be given him. As for my people, children are their oppressors, and women rule over them." So I just want to point out that we're in a time and season where we seem to have young people, with not experience, and women not in their place, not in their place. God help us all. And I just want everyone to clearly know I'm a doctor practicing by permission of my husband. Okay?
That's great. Wonderful.
All right. Thank you.
God bless you. We'll talk to you next time.
Thank you so much.